Quick note: this is an automated educational summary of public medical sources: Mayo Clinic, the NIH, and MedlinePlus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. If you've been told you might have rheumatoid arthritis, one of the first things your doctor will order is blood tests. But here's what most people don't know. You can actually understand what those tests mean, compare costs, and even order them online yourself before seeing a specialist. In this video, we're breaking down exactly how RA blood tests work, what they cost, and how to order them in 2026. Let's dive in. Let's start with the basics. According to the Mayo Clinic, rheumatoid arthritis is an autoimmune condition where your immune system attacks joint tissue. Unlike osteoarthritis, which comes from wear and tear, RA causes inflammation that can damage joints over time if left untreated. The CDC estimates over 1.3 million Americans have RA, making it one of the most common autoimmune diseases. Blood tests are how doctors confirm whether you actually have RA, since the symptoms can look like several other conditions. According to the NIH, doctors typically order 3 main blood tests when checking for RA: the rheumatoid factor test, the anti-CCP antibody test, and the erythrocyte sedimentation rate, or ESR. MedlinePlus notes that most labs will also check your complete blood count and metabolic panel to rule out other conditions. Some doctors add a C-reactive protein test to measure inflammation. Here's the important part. Not every RA patient tests positive on all these tests. About 30% have what's called seronegative RA, meaning some tests come back negative even though they do have the disease. The rheumatoid factor, or RF, is an antibody that attacks tissues in your joints. The Cleveland Clinic notes that a positive RF doesn't automatically mean you have RA. Some people have it their whole lives and never develop symptoms. The anti-CCP antibody test is more specific. According to Mayo Clinic research, it's positive in about 70% of RA patients and is often the first marker to appear, sometimes years before symptoms show up. If both tests are positive, your risk of developing RA is significantly higher, which is why doctors watch these patients closely. The cost varies widely depending on whether you have insurance, go through a lab directly, or use an online testing service. A typical RA panel, including RF, Anti-CCP, ESR, and a CBC, costs between $150 and $400 if you pay out of pocket. With insurance, you'll usually pay a copay or coinsurance based on your plan. Online testing services like Quest and LabCorp often offer discounts if you buy directly, sometimes as low as $100 to $200 for the full panel. Some employers even offer wellness programs that cover testing for free. Ordering RA blood tests online is straightforward in most states. You can go to Quest Diagnostics or LabCorp's websites, select the RA panel, pay online, and then visit a local collection center, usually within a few days. Some telemedicine platforms also offer RA screening packages where a doctor reviews your symptoms before ordering tests. Here's the key point. Getting tested online doesn't replace a real diagnosis. A positive result still needs confirmation from a rheumatologist who will look at your medical history, physical exam, and sometimes imaging. And if you have insurance, your doctor's order might be covered instead of paying out of pocket. When you get your results back, here's what to look for. The rheumatoid factor is measured in international units per milliliter. MedlinePlus lists the typical reference range as less than 14 IU per milliliter, though labs vary slightly. A positive RF is usually above 15. Anti-CCP above 20 units per milliliter typically indicates positive. ESR measures inflammation. The Cleveland Clinic notes values above 30 millimeters per hour generally suggest active inflammation, though normal ranges vary by age and sex. Remember, these numbers only make sense in your full medical context. Your doctor needs the whole picture before interpreting results. If your online test results come back positive for RF or anti-CCP, schedule a rheumatologist appointment as soon as possible. The NIH recommends getting a diagnosis and starting treatment early if you do have RA, because the first few months are critical for slowing joint damage. Even if tests come back negative, but you have symptoms like persistent joint pain, swelling, or morning stiffness lasting more than an hour, don't assume you're clear. Seronegative RA is real and still needs evaluation. Don't self-diagnose based on test results alone. Here's the bottom line. RA blood tests are affordable, and you can order them online yourself. Understanding what RF, anti-CCP, and inflammation markers mean puts you ahead when you talk to your doctor. If you're concerned about joint pain, swelling, or morning stiffness, getting tested is a smart first step. You don't need to wait months for an appointment. Check the description for links to Quest, LabCorp, and resources from Mayo Clinic and the NIH. What type of health tests are you interested in? Comment below and we will make a video about it.